Oh, always something. Well, you caught me adjusting the microphone. So, welcome again to Ave Maria, Florida, a Cadenza Medical Clinic. We are going to talk about over the counter medicine. What's in your, not wallet, but what's in your medicine cabinets. You'll be surprised. There's so many things out there that can possibly improve because there are so many um, junk in our medicine cabinets. But let's pray. Start with the Hail Mary. She's watching us, and I'll invite you. The Father, Son, of the Holy Spirit. Amen. Hail Mary, full of grace, the Lord is with thee. Blessed art thou among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen. So let's go. The first thing over the counter, you might be guilty. PPI or proton pump inhibitor, or the stronger version of antacid. You have it, Prilosec OTC, 20 milligrams. It could be as Acifex. Pepsid would be an H2 inhibitor, but they work the same way. Let's deal with the PPI. Very common. Sometimes you get admitted, you get sent home because it's usually commonly added in your hospital medication because it's supposed to prevent gastric ulcer or stress ulcer. It is meant to be given only temporarily when you're on steroid medications in the hospital to prevent gastric ulcer. However, in the process of hospitalization, when you get discharged, I, as a hospitalist, do this thing click, click, click. It's all done, generated, and then generate a list. Sometimes, because it's so overwhelming, sometimes the work, we sometimes cannot really go into the details, and the patient is sent home, sent to the pharmacy, and you have a stack of PPI, Prilosec, Protonix, um, proton pump inhibitor. The problem with that is that it is a very potent antacid. It suppresses gastric acid production. It has a good purpose. It prevents a bleeding ulcer because it can reduce significantly the, the gastric acid that is usually um, increased when you are stressed. As I said, when you're my patient, I've always explained stress is related to sympathetic overtone, whether it's stress from the hospital or being of having infection. So that's enough to prevent. And of course, the government would say we have to have this medication because it will be something like it's almost like a requirement that you have to take these medications in the hospital so that the score of the quality score of your care is increased or maintained. Unfortunately, what are the risks of the proton pump inhibitor? Number one, as I said, it reduces acid, it impairs digestion of proteins and absorption of common certain nutrients like vitamin B12, let alone iron, magnesium, and calcium. So you're left with deprivation of these trace minerals, especially iron. Now you go home, you already have a lot of uh, predisposition to iron deficiency because of other mechanisms. Then you go home and you forget, you continue taking this almost for a year. That's a problem. The other mechanism is that the other problem, big problem with this PPI is that it had been associated with and identified as a broad board exam question in internal medicine. The PPI, Prilosec, this example, can harm your kidney on a different mechanism. So now you're predisposed to chronic kidney disease and sometimes renal failure. Second, you're predisposed to increased risk of infection in your intestine. Have you heard of C. diff diarrhea or Clostridium difficile diarrhea? C. diff is comes from the same species of Clostridium botulinum, which is causes tetanus. The same, hard to treat. Well, C. diff can give you diarrhea. It's uncomfortable in itself, but the problem there of the C. diff is that it's a bad bacteria that is that suppresses the good bacteria. Well, really, it's the lack of good bacteria that allows the proliferation of C. diff. Well, because of the lack of acidity, the good bacteria is suppressed and thereby increasing the proliferation of C. diff, which causes inflammation of the colon, the large colon. And if it's enlarged or if it's inflamed, it can cause diarrhea because the function of the colon is reabsorption of the fluid. So now you have infection. Well, the gamut of C. diff colitis comes from mild to severe. The worst thing, the worst infection that I've seen was an 18-year-old guy who developed C. diff. And it was because of inappropriate uh, treatment of antibiotics for sore throat. And I made this example because most sore throat does not necessarily need antibiotics because this is usually post allergic or post nasal drip or could be viral infection. So you have that. As it goes to the severity, this particular boy who had a stoma or a colostomy bag in his belly at 18 developed severe infection and developed abscess in the colon from C. diff, from nothing, from it should not have been given. But they have to do, because it's an abscess, the treatment would be a surgical excision of that part of the abscess. And that led to colostomy bag insertion. It might not be permanent, but you have the trauma of that. So, was it necessary? Unfortunately, PPI can predispose you to this kind of infection. It also increases enteric conditions like salmonella, diarrhea, Campylobacter for the same reason, or suppression of the acid, which allows the pH or the acidity or lack of acidity to allow these bad bacteria to proliferate. There's actually a phenomenon of rebound acid hypersecretion when stopping after long term of this PPI. So it makes it hard to quit and can cause worsening of symptoms. Pepsid, or what do you call this, Zantac, has the same effect. Possible association with microscopic colitis or inflammation of the colon from the same mechanism. Antacid, which is like a trace mineral base, like calcium, what do you call this? Gasex, Mylanta, Malox, Tums, is calcium based. Magnesium in itself, especially magnesium citrate, not glycinate, can cause diarrhea and limits the absorption of other trace minerals. So you pretty much decrease the ability to absorb good nutrients. Aluminum based, paradoxically, can give you constipation. That's the Malox, I think, or aluminum hydroxide, Pepto-Bismol, and other things. Yeah. There's less impact on overall digestion since they neutralize acid rather than block production. What about the microbiome? We talk about this. It suppresses the ability to allow good bacteria to proliferate. And in reverse, it will allow bad bacteria to go. So remember the correlation of the proliferation of enteric organism or E. coli enterococci. These can proliferate and produce this substance called colectin. If you keep on taking this antacid, colectin will stimulate the colonocytes, which is the cell of the colon, causes mutation of that cell, and predispose you to develop colon cancer. So if you start early with stress, you get antacid, you get chronic constipation, then you're predisposing yourself to those calamity. There was an article about an influencer, a, a health guru, and she learned her lesson because she normalized constipation, which is defined as not being able to regularly move your bowels. She thought that it was a normal and acceptable to take senna, to take magnesium citrate, to take um, other OTC uh, medication to get her moving. Well, she developed what you call early onset colon cancer. And I think it's the same mechanism that you have this colectin because of the proliferation of the bad bacteria that allows the growth of these things in your body. So imagine she was chronically constipated when she was 25 years old. She had stress, and she thought taking those anti-constipation pills like Senocot or Psyllium or fiber would would do the trick. And she said it's normal. She had a very six-pack, lean abdomen, but what's inside was not healthy. So she had a message: do not normalize constipation. But what is the underlying uh, mechanism of all these things? It's the good bacteria that is suppressed. The good bacteria ferments all this fiber and protects you. So it's a mandatory that number one, you move your bowels with a good slide every day, even a couple of times a day. And it can only happen with adequate fiber, which I always say, do not buy over the counter fiber. It has to be 2 cups of vegetables minimum twice a day. Hydration, and preferably lemonade, so that it improves the acidity that can improve the absorption of trace minerals, especially iron, and also it improves the absorption of the other trace minerals. Lemonade or lemon water is a good fluid. Back again to the microbiome. So you have all these things that are coming from the mouth to your gut. Now think about the the microbiome that comes from the oral cavity, Provitella, uh, uh, this other cholinense. This travels to the joints and settles there, cause inflammation, and this is actually what would predispose you to develop arthritis, rheumatoid arthritis, for example, or even degenerative joint disease. So you think that the joint is not associated with your gut and microbiome. The microbiome or the gut, the yogurt that we're trying to proliferate, is the key to your health. Now, all these things that you accumulate in your body from the over the counter can compromise the microbiome. So, the immune function, it happens to be that PPI or proton pump inhibitors or Prilosec have a direct effect on the immune cells, altering neutrophil function. The neutrophil is the one that gets activated right away when there is infection and kills them. So if you're taking those medications, you're making yourself immunocompromised, literally. The What are the other antacid? Oh, the over-the-counter medications. We talk about PPI. Second, your number one enemy in your medicine cabinet are the NSAIDs, non-steroidal anti-inflammatory drug, or NSAID. It comes as ibuprofen, naproxen, meloxicam, anything with Sicam or Profen. That is uh, has a, a chronic taking of these medication can harm your kidney on a mechanism that it can constrict. It eliminates the production of the prostaglandin, good prostaglandin, in your kidney, and compromise the blood flow in there. And also, it can also cause gastric ulcer. So, those medication, I have to tell you this, that in my practice of medicine now, almost going to 40 years, I still have to write a prescription of ibuprofen myself. When somebody has headache, I recommend Tylenol. It's a better alternative. You really have the Tylenol harm can only happen when you have a box full of Tylenol. But the mechanism of destruction of the NSAID, especially when you have compromised kidney, especially when you're diabetic, can predispose you right away to develop kidney disease. So why would you keep it? Because it was just given to you. Worse is, I see nurses in the hospital and giving NSAIDs to kids that are sick in itself. That actually fuel inflammation in your stomach, causing gastric ulcer. So the practical takeaway is this: if you have acid symptoms like bloating, bloating is usually from the building of gas because you're constipated, or if you have acid symptoms like reflux disease, it's not usually acid. It usually comes from the dysbiosis, the lack of balance of your bacteria that protects it, and also the leaky gut. That is why most of my patients that I've treated, if I treat them naturally with the good bacteria and the supplement like from metagenics, they get better and continue to improve. The pain relievers, we talk about NSAIDs, ibuprofen. So let's put that aside. We should be convinced that it's harmful for you. Tylenol can damage liver. However, with overdose, one maybe will not harm you that much. Antihistamines, Benadryl. Sometimes it's also marketed as the something with Zidin. It was just shown to me a while ago. Benadryl, doxylamine. Number one, olratadine, cetirizine. Those are Allegra. They can, number one, cause drowsiness. So you better not take that when you're about ready to drive. It is usually used to sleep. Well, paradoxically, when you take Benadryl, especially when you are mature, I'm not saying old, the metabolites can cause confusion. What is the consequence of confusion when you're at night? You are disabled, you are imbalanced, and you have propensity to fall. When you break your hip, you have almost like a morbid sentence. 6 months lying in bed can predispose you to pneumonia, other mechanisms of immune dysfunction because you're not able to mobilize. So it is a risky pathway. If I were you, get it analyzed why you're not sleeping well. Maybe it's your sleeping hygiene. Maybe you're taking something that's stimulating your brain. Focus first. Try meditation because the meditation can help you increase those normal neurotransmitters like the melatonin, taurine, GABA that helps you, even melatonin, no? That helps you sleep, get to sleep. What about decongestants? It comes in NyQuil, it comes in anything that's over the counter. Number one, it has been reported actually in JAMA that these medications commonly used for decongestant does not really have a bearing in terms of fixing the problem. What is the usual cause of decongestion? Number one is allergy. So fix the allergy, nasal spray. Second, usually common virus called rhinovirus. Rhino means nose and virus. Get your immune boosted up with vitamin C, vitamin D, check your level. That's the approach instead of patching the symptoms with that. Common remedy, for example, like um, um, cloves that improve the mucin because mucin is needed to protect you from the entry of those common entry of common virus. So Pseudoephedrine, which is common in the decongestants, can increase your heart rate. It's almost like taking Red Bull. You better not take Red Bull. What is the effect? It can give you chronic tachycardia or increased heart rate. But remember, the heart is a muscle. So you're flexing all the time, you're increasing the muscle bulk. When your heart is always constantly racing, it can increase in muscle mass. But this muscle mass is weak. It can predispose you to cardiomyopathy, a weak muscle in large heart with, with very poor pump function and can cause subsequently a congestive heart failure. Take note, a patient of mine, he looks like Sean Connery, big guy. And when I examined him, he had a pacemaker. He was only 50 years old. So what happened, Bob? Well, he had a bad shoulder from lifting and all this stuff, big muscle. But I said, I abused myself, doctor. I was using those stimulants, like Red Bull and all this stuff. Got him a pacemaker when he was like 40 years old. So these are serious things. I was so happy when one time I saw an EMS guy with his Red Bull, and it's very prevalent among young athletes. If you go to the Google Scholar, check out Red Bull or stimulants, common emergency manifestation, they end up with tachycardia or SVT, and they end up in the emergency room. So that's the decongestion. It gives you jitteriness. The more it gives you insomnia, and it actually give you some problems associated with insomnia, like it can cause, if you're not sleeping for a week, that can predispose you to have some psychotic spells, and that is a real thing. Nasal spray like oxymetazoline, it can give you rebound congestion, and it's more difficult for you to control your congestion, nasal congestion. Laxatives. These are the magnesium citrate, um, enema sometimes. Well, it can cause electrolyte imbalance, especially sodium and potassium. Well, potassium, don't underestimate the function of the potassium, because if your potassium gets so low together with magnesium, it can predispose you to heart arrhythmia or irregularity in your heart. I feel it myself. I felt it myself when I was sleep deprived, because of sleep deprivation can decrease your magnesium level, and I was affected. Heart rate went up to 220 per minute. It was not a funny feeling. The cough suppressants like dextromethorphan, it comes as Robitussin DM. The DM is dextromethorphan. Well, what's the story of dextromethorphan? Dextromethorphan is actually a mild type of opioid. Number one, it can cause confusion. Opioid comes as mild as dextromethorphan. There was one medication that was called Darvocet, propoxyphene. Thank God that was made. They retired that medication because number one, it only gives you confusion, does not give you pain control, and on the extreme end, the opioids, the oxycodone and the morphine. These can cause constipation. Number one, drowsiness, confusion. So why would you keep that DM in your, especially combination, perfect combination, Tylenol DM plus Benadryl PM. PM is indicates that for sleep, and they use Benadryl. Well, paradoxically, that Benadryl can keep you awake, and when you're awake, it can give you confusion, and when you're in the middle of the night confused, you can fall. These are the medications that are associated with fall injury, including Ativan and all those stuff. The general cross-cutting is this: NSAIDs, the blood thinner, the decongestants, the masking symptoms of underlying condition, it does not really help. Then you have these medications, the cold medicine, which is not really helpful. Cold medicine should be treated with echinacea, cloves, and boost your immune function with vitamin C, glutathione, zinc, B complex, and if you have access to IV medications, vitamins, get it because I have experienced it and it's proven by science that it can help common symptoms, especially even allergy and also common viral infection. It's affordable rather than going to the emergency room and getting yourself predisposed to this. So then again, we can summarize. Les, thank you very much for watching from Germany. She's in Germany. I forgot her name. Where are you in Germany? I forgot. Berlin, I think. Anyway, thanks for watching. In summary, over the counter medications in your medicine cabinet, get an examination. What are they? Identify NSAIDs, ibuprofen, take them away. Number two, PPI, Prilosec, proton pump inhibitor, Pepsid, you don't need that. Come to me, I'll help you. Antibiotics, old antibiotics, just because it was not consumed. Oh, I took amoxicillin. But that amoxicillin becomes over the counter in your medicine cabinet, can give you severe diarrhea or C. diff that can predispose you to abscess formation in your colon, which needs to be cut like surgical excision. And you can develop, the only way to do it is to continue with a colostomy. That's how serious it is if you take antibiotics just left and right. That's why you have to twist my arm, really, if it would have to take antibiotics. And my patients know it. Common medications that wouldn't help you sleep, they don't. Paradoxically, it will aggravate your sleep deprivation. Allergy medication, we talk about that. There are some natural remedies that we can use. Melatonin for sleep, GABA, taurine. Well, guess what? All these three substances alone, if you meditate, especially if you start guided breathing and pray the rosary, it helps you sleep. If you start using the chaplet of divine mercy, it can help you sleep with a guided breathing because neurophysiologically, it had been shown in science that in MRI, the hippocampus is a perfusion is increased that helps you calm the brain and decreases the circulation to the amygdala, which is a center for anxiety and negative thoughts. And if you have anxiety, depression, or anger, how can you sleep? Well, if you meditate, start meditating with His unconditional love through His passion, or even the rosary, which is essentially the whole story of His unconditional love, then you'll be able to sleep better. It will calm the probiome, the microbiome, which helps you sleep because remember, 90% of the microbiome is produced in the gut, not in the brain. Consider and highly recommend take the medical yogurt that we make or do it yourself at home. Increase your fiber because that's the key. You're not allowed to be constipated. Constipation is illegal. You need to move your bowels movement. And if you have problems with that, consult me. I can help you with that. Hydration. Of course, exercise is needed because that helps also. Like yesterday, it was raining, but prior to that, we were running with my good friend, Father Leandro. And we ran out of, we were caught in the rain. It was, somebody made a comment, oh, you were smiling under the in the rain. It was good, and it helps you sleep. Sauna helps if you have the luxury of that, um, and fasting also, intermittent fasting. This decreases the inflammation. So, over-the-counter medication. Have an examination of conscience. What is in the medicine cabinet? Sugar makes it also make you bouncy. So all those gummies right there in the medicine cabinet, please eliminate them. There are preservatives and sugar there. With this, we come into conclusion that over the counter medication does not necessarily mean a good remedy for you. Increase your what do you call this? Your library of natural remedies, cloves, chamomile tea that makes you calm. In my opinion, now that we discussed this, what's urgent at home would be bleeding, minor cuts. So buy a strip. Learn how to to um, to put the strip, gauze, sterile gauzes, alcohol, chlorhexidine to prevent also staph infection. That should be what you need to be in will be placed in your medicine cabinet. Stay away from all those medication, over-the-counter medications. Alcohol, Steri-Strip, chlorhexidine. You don't need a stitch. Those Steri-Strips can help you, or a bandage, or a Coban bandage that will help prevent bleeding. Other than that, in my practice of medicine, that's the only thing that really is urgent. Urgent versus emergency. Emergency, do not deal it with yourself. Call 911 because emergency needs further attention. Urgency, you just have coughing, you're thinking about pneumonia. It doesn't happen overnight. Have yourself properly evaluated with a CBC and a chest x ray. If you're dehydrated from diarrhea, you have no business doing that. You can do that even here. We get IV infusion and all those stuff. So that is my remedy. Meditation as a center, microbiome, the yogurt, the fiber, exercise. That's how we're going to live a very healthy um, lifestyle. And it's all in the books of the Catholic Church. Till next time, we're going to entertain, we'll have more topics and related. In the meantime, we're going to entertain questions. And Leslie, thank you very much for watching from Germany. One, Leah?
What's the best way to dispose of them?
I think it has to go to the biohazard. Biohazard, we have biohazard here. You can deposit it here because they will dispose it properly. Because you don't want to flush it because it goes to our sewage.
Yes.
What is your experience with apple cider vinegar?
Those are good.
Can you take that daily or?
Yeah, it should be as long as if you tolerate. Yeah,
Okay.
but consider neutralize that with yogurt because it's really a good. The yogurt combination with other things is really I'm noticing it really good. Do you have any questions?
A tablespoon or an ounce?
Say it again.
Oh, apple cider vinegar. How much?
Apple cider vinegar, a tablespoon would be fine. And put a honey to down it. Leah, please.
You forgot about meat.
Oh yes, people have been experienced that mead is a natural honey wine, and it seems like patients are really appreciating the benefit of it. Well, honey, because it has no preservatives. It if you know who's making it, it has no sulfite. Sulfite, I stopped actually taking red wine from Spain because it has sulfites. It was good from some, but mead seemed to be consistently helping people go to sleep. Just not even a glass. It's just even a shot gets you drowsy. I think Mary had experience. She was
Yes.
dancing and
He gave me one last week for my birthday. I have
yes.
this much left.
I think we have some mead here that we can try. So, what else do you have? Any Ruby? Do you have comments?
Proper disposal of medications. I learned Walgreens, actually the one on Mountain.
Okay, Walgreens.
Has a dispenser for meds.
Okay.
Prescription meds, especially that you even safely.
Oh, that's great. So don't just flush it because that will go to our sewage system. The medications, the over-the-counter medications, especially those. Unfortunately, the hormones, the what do you call this? The oral contraceptives. Ave Maria University students actually were studying that, and it was just amazing how it's so prevalent in our sewage system. Do you have any questions?
How about Advil?
Advil is NSAID. They belong to the family of Advil, naproxen. That's actually naproxen, if I'm not mistaken. Um,
Excedrin.
Excedrin is antihistamine with other components. So when you have those sniffles, I highly suggest get vitamin C IV, glutathione, even oral thrush. I had a patient from out of town and they came over because this one here. I gave high dose vitamin C. It seemed to work. Even common fatigue symptoms. So, yes, Hildy,
How
please.
about rosemary tea with some honey?
Yes, tea is not should not be just be. Thank you, Sam. The oh, she's examining the medicine cabinet soon. So the other thing is this: tea. You expand the world of tea. I highly suggest number one, if you have moringa, get a stem of moringa, take it, boil it. That will be a good tea. Put honey, put some lemon. Second would be if you have pandan leaf, I have some. It's good to propagate. Artichokes, those are good. Always put what do you call this? Clove powder. Clove improves the mucin production. Remember, the lining of your nose is covered by mucin layer. The same lining on your intestine. Now, if you want to, if you want to improve the taste, of clove, because that can the virus can enter the mucous membrane if you don't have the mucus, and you have to have the IgA antibody also, and that comes from the production of yogurt. So you don't want the yogurt. Do not ignore the yogurt, the regimen of yogurt. People have benefited. I want to put them one on the spot, and I have a case of acne rosacea. Came in with a really red face. It was difficult for her, and you think skin would be treated with a lot of this, but I told her it starts from the gut, and sure enough, thank God. Anybody else?
What about sinusitis?
Sinusitis is basically a lot of times this is inflammation from allergy or common virus. And remember, virus um, and allergens respond well to vitamin C, glutathione, and common remedies like zinc concoction and all this stuff.
You mentioned chlorhexidine. What is that?
Chlorhexidine is actually, I can show you here. It's actually specifically to prevent uh, MRSA, staph infection. So keep that in your cabinet. The other thing also is this: I highly suggest if you can find some organic bug remover. In Florida, I've seen the worst bug bites that I've ever seen. Here in my scalp, right here, at one point, I thought I was developing this weird lesion. When I was running, I always would go outside, and these are fine things. And you know it is bugged because there's so many punctate. So those things can be prevented. And the way to I discovered that it was a bed bug because my friend is sensitive to mosquito bites, had a this bug zapper. It zapped and then it heals. Well, I tried it. It healed. So I said, like, oh, it's a bed bug. It was a not bed bug. It was a bugs. It was a mosquitoes and all the stuff. So when you see me running, it's not that I'm covering my bald head. It's against the bugs.
Lavender
Spray, you know? Yeah.
Okay.
And lemongrass and lemon and all the stuff. Citronella.
Yeah.
So I think
What
uh,
did you say helps MRSA?
chlorhexidine. Chlorhexidine.
You can get rid of that for a while.
You can buy that from over the counter.
Over the counter.
Yeah. All right. Anything else? Till next time, we're going to double another topic related to medicine and faith. So thank you very much, Miss Sandra, um, and Leslie in Germany. So we're going to say goodbye. Bye bye.